This is a presentation on an evidence-based implementation proposal. It has been prepared for the Graduate School of Nursing at the University of Hartford. Today's presenters are Robin Sizz, Jesse Finkelstein, Kristen Hardy, and Aaron Thompson. The objectives for this presentation are as followed. Today, we will summarize the proposed evidence-based implementation. Next, we will identify the clinical question that supports the future intervention. We will discuss the background of the clinical problem and its relevance to the nursing profession. We will review our evidence-based intervention plan. And lastly, we'll examine plans for analysis. Our team of nurses has formed a problem, intervention, comparison, and outcome question. It is as followed. In acute care nurses, how does the implementation of one educational in-service aimed at identifying burnout syndrome and the methods of coping affect nurses' levels of burnout compared to the levels prior to the intervention? This research question follows the PCOT format. According to Gallagher and Malik, the PCOT format question is a search strategy where the best identified terms are used to find the best evidence to address a clinical question. Our team took the broad category of the nursing burnout phenomenon and broke it down into a specific planned intervention and outcome related to nursing burnout. Our goal is for a sample of nurses to recognize the signs and symptoms of nursing burnout after one educational in-service. Our hope is that the participants are able to report back the signs and symptoms of burnout and experience a reduction in nursing exhaustion over a period of time post-intervention. So why did our team choose burnout? As a team, we identified a clinical problem that we are all too familiar with and feel incredibly passionate about. This is burnout syndrome. Our group was able to generate strong evidence that nursing burnout is a critical issue that exists within the nursing profession. We chose this clinical problem because it continues to be an ongoing issue within the nursing profession. According to Brown et al., research indicates by the year 2025, the United States nursing shortage will reach between 260,000 to 400,000. And nursing turnover will be a profound reason for this outcome. Low retention rates are definitely multifactorial. However, increased amounts of stress and decreased job satisfaction are large contributors. One study concluded that 1 in 5 nurses prepare to exit the profession within a year. And nurses with 10 or more years of experience stated they had elevated levels of moral distress. This highlights a snowballing stress effect. Another study that took place in a large medical organization in Ghana demonstrated that 91% of 232 nurses experienced moderate to severe nursing burnout and exhaustion. One quantitative study examined the reasons for high levels of burnout among oncology nurses and found that the nurse-patient ratio seemed to be a large contributor. These nurses also felt that burnout could have been avoided with adequate resources, teamwork, collaboration, and better support from family and friends. Next, I would like to give a brief overview of our implementation proposal. I would like to utilize the Plan, Do, Study, Act to give you this overview. First, our team developed a problem, intervention, comparison, and outcome question. We then took this question and performed evidence-based research. We then created an educational intervention, decided where the intervention was going to take place, We then reached out to agency contacts, and we are currently awaiting organizational approval. We plan to perform this intervention with acute care nurses. Our sample population will be nurses from one cardiac and vascular surgical unit. The intervention will be implemented with nurses who agree to participate. The date of the implementation will take place in 2022. The actual date is to be announced. We will then analyze our data generated from the educational in-service. We then hope to disseminate the intervention results to stakeholders and apply evidence to help increase unit awareness regarding nursing burnout.
Burnout is the physical, emotional, and psychological feeling of exhaustion. It is composed of depersonalization and emotional exhaustion. According to the World Health Organization in 2019, said that it was a feeling of energy depletion, increased mental distance from one's job, a feeling of cynicism related to one's job, and reduced professional efficacy. Burnout was used to describe workers' reactions to chronic stress in workplaces that required regular and direct interactions with others. Medical professionals face a greater risk of burnout due to the high risk of their work environment. In 2001, 43% of nurses working at U.S. hospitals experienced symptoms of emotional exhaustion. Nurse burnout can affect your job performance and lead to increase in mistakes and med errors. The need for nurses. According to the World Health Organization's report, there are 29 million nurses and midwives globally. 3.9 million of them are in the United States. According to the ANA, more registered nurses will be available through 2022 than any other profession. The demand for more nurses is only increasing. Now is the time to focus on keeping the nurses we have in the workforce. The U.S. Bureau of Labor Statistics projects 11 million additional nurses are needed to avoid a further shortage. Nurse burnout factors, the COVID-19 pandemic, unpredictable workloads, mandatory overtime and long shifts, increase in patient mortality, working short-staffed, a lack of sleep and self-care, and a lack of workplace support. Symptoms of nurse burnout: lack of empathy, a lack of desire to go to work, chronic exhaustion and frustration, social withdrawal and isolation, depression, anxiety, which all can affect your home life. Nurse burnout leads to unhappy nurses, altered mental health and well-being, a decrease in quality of patient care and patient safety, an increase in infection rates, and also an increase in nurses calling out, which leads to an increase in job resignations. The solution to nurse burnout: become more involved in support groups, establish work buddies, get involved in stress reduction techniques and coping skills such as exercise and breathing techniques, improve staffing and teamwork, adjust your work schedule and hours and decline any overtime when offered, take work breaks, utilize your vacation time, and improve in an improvement in management support.
With our EBI project, pre-education and intervention, nurses will receive an email asking if they would like to be part of our EBI project with no names collected. If yes, they will receive the following: a MASLOC burnout inventory, MBI, HHS for medical personnel through SurveyMonkey, and a link to our online module, which on our first slide will consist the survey of our pre-survey. Our pre-survey will have a list of demographic questions, 5 questions to gauge the knowledge of the signs and symptoms of burnout, and the MBI questionnaire. With our education and intervention, the acute care nurses will watch a short video of the signs and symptoms of nursing burnout and how to combat those signs and symptoms. This will be an online module that can be watched anywhere with access to internet and their work email. Post-intervention and education. Immediately following the online module, on the last slide, there will be a link to the same survey they took prior to the module and education service. The survey will have a list of the 5 questions asked in the pre-survey. 30 days later, the acute care nurses will receive an additional MBI survey utilizing the SurveyMonkey with an additional yes/no question asking if they participated in self-care since the intervention and education session.
So here we have listed the MBI that we'll be using. Burnout is a collection of depersonalization and occupational exhaustion. It is combated by a person's personal accomplishment assessment. Therefore, there are questions targeted to figure out which level of depersonalization you have, which level of occupational exhaustion, and which level of personal accomplishment you have. Listed here on this slide is the totals. So you have to take all of the answers for each specific question, each category. You end up with a degree of occupational exhaustion, either low, moderate, or high. Same for depersonalization or personal accomplishment assessment. To the right, we have listed the scale in which we will be using based on your occupational exhaustion, your depersonalization, and your personal accomplishment assessment. That will be how we figure out how much burnout someone actually has when they fill out this survey. We can then figure out percentage-wise how many percentages of the nurses that participated in this study were exhibiting low, moderate, or high burnout prior to our intervention, and then 30 days later, what the percentages look like then. This way, we can go ahead and do the analysis of the effectiveness of our EBI. And so we're doing this in 2 separate categories. We're judging the effectiveness of our educational presentation, so utilizing a pre and post survey right before the presentation and immediately after to make sure that our education is cohesive, consistent, and easy to comprehend. And then we'll also be judging the effectiveness of our intervention on burnout, so utilizing the pre-intervention MBI and the post MBI 30 days later to see what the levels of burnout are pre and post our intervention, with an added question of yes or no if you have participated in any new self-care activities. That way we can demonstrate what was it that decreased the burnout. Obviously, a PowerPoint presentation isn't going to be the actual thing that decreases burnout. It's what we're educating them on that decreases it. And that is our presentation. Thank you for listening. And here are our references.